Hi everyone. Today in this video let us discuss side effects of metoprolol. What is this drug metoprolol? The suffix -olol indicates metoprolol is a beta blocker. And among the beta blockers we can have two types of beta blockers, cardioselective and cardio-non-selective. Here metoprolol is a cardioselective beta blocker which is selectively acting on beta 1 receptors located on cardiac system. Metoprolol can be particularly used for cardiovascular disorders like angina, where this drug can reduce the cardiac pain by reducing the cardiac work. Similarly, this drug can be used in the conditions like heart failure, where again metoprolol reduces the cardiac work, thereby increase the cardiac efficiency. In the treatment of heart failure, many of the beta blockers are contraindicated because they reduce the force of contraction. But still metoprolol can be used in the conditions like heart failure as it reduces the cardiac work and increases the cardiac efficiency. Similarly, another clinical use of metoprolol is in the treatment of hypertension, where this drug can reduce the blood pressure. In this way, metoprolol is having various clinical uses. All these are related with cardiovascular system, and it is highly selective for beta 1 receptors expressed on heart. But still it can show few of the side effects, and it can affect various organs like central nervous system, lungs, even eye. So it can produce various side effects when it is indicated for cardiovascular disorders. So today in this video let us discuss the 8 important side effects of metoprolol and how they are produced and how they can be managed. Let us start one by one. The first one is the dizziness. Just we have discussed that metoprolol acts on the heart, but at the same time it can also enter into the brain and it can affect the functionality of the CNS. Particularly it can produce some depressive effects. Therefore this drug can produce some lightheadedness and dizziness in the people. This is particularly observed when you are going to change your position. The dizziness can be increased. If you change your position from lying position to the standing position or lying position to the sitting position, a chance of lightheadedness and dizziness can be produced, which is more pronounced in the first few weeks of the therapy. That's why the early days of use of metoprolol, care should be taken while you are standing or sitting, and this dizziness can be increased with other drugs co-administered with metoprolol. This metoprolol is supplied as its ester form, metoprolol succinate. This medication is available as a capsule as extended release capsule. It's called ER capsule or XL capsule. From this capsule, the drug is slowly released, but the release of drug from this medication may be modified by other conditions. For instance, when you are going to take the alcohol along with metoprolol, alcohol can increase the release of this medication from this extended release capsule. So instead of slow release, metoprolol can be released very rapidly from this capsule, which may increase the side effects produced by this medication. That's why in presence of alcohol, we can observe more dizziness because of rapid release of medication, as well as alcohol can itself produce some dizziness. That's why along with metoprolol, intake of alcohol is not recommended. Second one is the bradycardia. Metoprolol is a beta blocker and it is a cardioselective beta blocker, and it can be used for the treatment of hypertension as well as tachycardia, where heart rate is excessively increased. In such conditions we can use the metoprolol, but whatever may be the clinical use, its main action is on the heart. So metoprolol can act on the beta 1 receptors located on the heart, which are blocked, that results in the decrease in the heart rate. So with use of metoprolol, we can observe slowing of the heart rate, which is commonly known as bradycardia. And this bradycardia may also increase the dizziness in the people. And in few of the people, we can also observe some irregular heartbeats because of slowing of heart rate. This is commonly observed in many of the people because metoprolol is directly acting on the heart and it can reduce the force of contraction as well as rate of contraction. Under therapeutic dose, this bradycardia is not that much troublesome. But when this metoprolol is used at a very high dose, this medication can produce some significant slowing of the heart rate. Third one is the fatigue. Just we have discussed that metoprolol is a cardioselective beta blocker, so it mainly acts on beta 1 receptors located on the heart. Even though of high cardioselectivity, metoprolol can also act on beta 2 receptors which are located on different types of organs. Among them, the blood vessels supplying to the skeletal muscle are more important. Normally, these beta 2 receptors are responsible for vasodilation. They can increase the blood supply to the skeletal muscle. Now, metoprolol can block these beta 2 receptors, which can result in the decreased blood supply. So, when blood supply to the skeletal muscle is reduced, muscle weakness can be increased. So, patients may have some fatigue, some unexpected weakness can be observed. Similarly, metoprolol can also act on the heart and it can block beta 1 receptors, which reduce the heart rate. Because of decrease in the heart rate as well as decreased blood supply to the skeletal muscle, with use of metoprolol, patients may have some unexpected tiredness and muscle weakness. Fourth one is the breathing problem. Metoprolol shows some less breathing problem compared with non-selective beta blockers, but still at higher doses, the selectivity may lost, and metoprolol can also act on the bronchial smooth muscle and it can block beta 2 receptors. Again, these beta 2 receptors are responsible for bronchodilation, but when these beta 2 receptors are blocked, it results in bronchoconstriction, leading to shortness of breath and trouble breathing. Because of more cardioselectivity, these side effects are rarely observed with metoprolol, but in the people with any bronchospasm, these side effects may be more enhanced, and in the people with severe bronchospasm, metoprolol is contraindicated. Fifth one is the pruritus. Epinephrine is one of the neurotransmitter in the sympathetic system. This epinephrine can block the activity of mast cells, so it can reduce the degranulation, thereby it can reduce the allergic response. The mast cell mainly stores one of the mediator, histamine, which is responsible for allergy. This allergic response is blocked by epinephrine. Now, metoprolol is a beta blocker, so it can block the actions of epinephrine so that the degranulation of mast cells can be increased, resulting in the release of histamine. Now, histamine can produce various allergic responses, resulting in itching sensation, skin rashes. So, with use of metoprolol on long term, we can observe some pruritic conditions. Sixth one, blurred vision. This is a common side effect observed with the metoprolol. Metoprolol can produce some blurred vision. Even it can increase the sleepiness, some somnolence in the people. It can also produce a state of confusion, as well as it can induce some dry mouth. All these side effects are commonly observed with metoprolol. Seventh one, hypotension. Just we have discussed that metoprolol can be used to treat hypertension. How this drug is going to reduce the blood pressure? By acting on cardiac system. Since metoprolol acts on the heart, it can block the beta 1 receptors. When these receptors are blocked, it results in the decrease in the heart rate. As the heart rate is reduced, it can reduce the afterload, the pumping pressure. When this pumping pressure is reduced, it can reduce the blood pressure. In this way, metoprolol can reduce the blood pressure by indirectly reducing the heart rate. So with use of metoprolol, we can observe some drop in blood pressure. Both systolic as well as diastolic blood pressure can be reduced. And even we can observe the drop in pulse rate. So with higher dose of metoprolol, a significant hypotension can be produced. That's why it is always better to start with low dose in order to treat cardiovascular conditions. Eighth one is the mood changes. Even this is a rare side effect, but metoprolol can act on the CNS and it can produce some depressive effect. So with use of metoprolol, patients may have some hallucinations, either auditory or visual hallucinations. They may have some anxiety, some nervousness. Even they can have some insomnia, lack of sleep. And this medication can also produce some depression in the people, which are even rare conditions, but they can be observed with very prolonged use of metoprolol. So these are the 8 important side effects of metoprolol that are commonly observed. So that's about the side effects of metoprolol. Hope this video is useful to you. If you observe any other side effects of metoprolol, post them in the comment box. In the next week, we will come with another interesting topic. Until then, stay tuned and keep watching. Thank you for watching this video.